We're live.
Hi.
All right. Good morning, everyone. Thank you to the members of the Joint Committee on Audit and Evaluation for joining us this morning. We have a packed agenda with problem gambling, the Maryland Excels program, as well as state scholarships on the agenda for today. I want to kick it off by introducing and welcoming my new co-chair on this committee, and that's Delegate Jared Solomon. So it's great to have you here, and welcome.
Thank you, Senator Lamb. It's a real honor to be here with everybody and to be in this role. I just want to welcome everybody here, members of the House of Delegates, members of the Senate. As Senator Lamb mentioned, we have a really distinguished group of folks with us today, and I think today's lineup is going to be really enlightening. We're looking at a number of program evaluations. We'll be getting into our audits later in the fall, but a lot of really important programs that we had a lot of hard work go into the evaluations. So without further ado, I think we're excited to kick it off to Mike Powell and Grant Mayhew of the Office of Program Evaluation.
Thank you, Mr. Co-Chair, both co-chairs, and let me get right into it. So this is a presentation, and Eric, if you can put the slides up, on our evaluation of the Center of Excellence on Problem Gambling. If you don't know what the center is, it was created in 2012, and it's funded by the Problem Gambling Fund, which was created back in 2007 by the General Assembly when casino gambling was legalized in Maryland. And where it is on the org chart can be a little bit confusing. It's part of the health department under the Behavioral Health Administration, but it is run by a contractor that's a competitively bid contract, and that contractor is and has been the University of Maryland School of Medicine, the School of Psychiatry. And what the center does is they conduct prevalence studies and other research. They operate a 24-hour gambling help hotline. They provide treatment services, they provide peer support, and a variety of other services. And I can't see the presentation, but I trust it's up there. And if it is, Eric, if we can go to the second slide. Revenue going into the problem from the Problem Gambling Fund is about $4.7 million a year. And that's funded by fees on slots and table games, and that's mostly on slots. And the funding sources for the Problem Gambling Fund have not changed as more forms of gambling have been legalized in the state. I do want to point out that little dip in revenue between 2019 and 2020 was because casinos were briefly closed and then reopened at a limited capacity because of the COVID pandemic. Next one, Eric. And these are the expenditures from the Problem Gambling Fund. They mostly go to research and to clinical services, and the little green bars in the last couple of years are spending on advertising. And some of you may have seen the PSAs that the center has run on television about how to get help if you have a gambling problem. Next one, Eric. Now, this is the money that is gambled in the state of Maryland. And the blue line is money spent on traditional lottery, and that has grown over the years to about $2.5 billion with a B dollars per year. And then you can, if we can go back, Eric, and then the orange line is spending on casino gambling, which has grown to almost $2 billion a year. And you can see where it started in 2011 and has grown since then. And then the little gray line you see at the bottom is sports wagering. And back in 2021, sports betting became legal, but you had to do it in a sports book. So you had to go to a casino to place a bet. And in late 2022, and that's when we began doing this evaluation, you were able to start betting on sports on your phone. And our evaluations are typically backwards looking, but I'd be remiss if I didn't talk about what's happened since we started this evaluation, which is that $3 billion has been gambled on sports via mobile devices. And my estimates are that by the end of this year, $4 billion roughly will be gambled on sports via mobile devices in 2023. So that line will literally be off this chart if my estimate is accurate. Next one, Eric. So what is problem gambling, or it's sometimes called disordered gambling? There are diagnostic screening tools that are used to identify people with gambling disorders. And the problem gamblers and what are called problem pathological gamblers are people who answer yes to multiple questions. And some of those questions are things around Do you lie about gambling, maybe to your family, or lie about losses in gambling? Do you want to stop gambling, or you've tried to stop and you're unable to? Have you stolen to pay for gambling? And do you have relationship problems or problems at work because of gambling? And if you answer yes to a certain number of those questions, you would be classified as somebody with a gambling disorder. And the next bunch of slides, I'm going to turn over to my colleague, Grant Mayhew. Grant?
Thanks, Mike. So just a quick background. Researchers in Maryland have conducted 4 statewide prevalence studies of gambling and disordered gambling. Those were in 2010, 2017, 2020, and 2022. The estimates of lifetime disordered gamblers range from a low estimate in 2017 of about 80,000 people to a high estimate in 2020 of over 400,000 people. The graph here shows that when comparing 2010 to 2020, the awareness of help for disordered gamblers has increased across the board. It should be noted that few other states conduct prevalence studies, and there has not been one done nationally. Next slide, please. So a person may call, text, or chat with the 1-800-GAMBLER helpline. Combined, these were done over 850 times in 2022. Chatting has grown in usage year over year and accounted for almost 30% of the communications with the helpline in 2022. The evaluation does include, go back one. The evaluation does include an example chat. It's Exhibit 3.1 if anyone is interested in seeing what that output looks like. Other forms of help that go beyond the 1-800-GAMBLER helpline may include peer support specialists, free treatment services such as therapy, services not affiliated with state government such as Gamblers Anonymous, or programs through the Lottery Commission such as the Voluntary Exclusion Program. Next slide. This graphic compares the number of Marylanders identified as disordered gamblers, both probable pathological gamblers and problem gamblers, with the number of Marylanders seeking some type of help. So the graphic is a three-year accumulation, but in a given year, let's say 100,000 people may have a gambling problem, and a few thousand are getting help in one of the ways listed. People could also seek privately funded treatment, or they may seek help from family and friends. Research and interviews with center staff indicated that the stigma of feeling ashamed of the problem is a frequent reason people do not seek help. Next slide. The medical community recognizes disordered gambling as an addiction similar to substance abuse. The Problem Gambling Fund pays for treatment, usually therapy, to problem gamblers at no cost. Treatment is paid for by either Medicaid or the Problem Gambling Fund, which is roughly an even split. Data on the provision of these services is limited, but generally speaking, the gender of those seeking help is evenly split. And this graphic will show that 2/3 of those seeking help are between the ages of 31 and 60. So that's the green, the black, and the dark gray pie pieces combined. Next slide. So over the last 3 years, the state has paid a little over $800,000 for problem gambling treatment. And since it's not listed in the graphic, the actual total of the right-hand column is $820,509. Next slide. No-cost treatment providers are generally licensed therapists who are trained to treat addiction. This bar chart shows that no-cost treatment providers grew by about 50% from June 2018 to the end of 2020. Providers are spread among 5 regions in Maryland, and many offer telehealth appointments. Next slide. So it's important to note that there is no federal funding for problem gambling. According to the National Council on Problem Gambling, the NCPG, only 21 states have any full-time employees dedicated to problem gambling. NCPG ranks Maryland about 8th per capita in spending. And I think with that, I'm going to throw it back to Mike.
Yeah, last slide, Eric, please. So we had 6 recommendations in our report, and I just want to highlight 2 of those, which are highlighted on the slide. The first is that is working with the Voluntary Exclusion Program, which is part of the Lottery Commission. And right now you can go in if you have a problem gambling and you can ask to be voluntarily excluded. So a casino won't allow you to gamble. And it'll also ask you if you want to be contacted by the center for help with a potential gambling problem. And our recommendation is just to consider defaulting to people being contacted by the center unless they choose to opt out when they go in to voluntarily exclude themselves from gambling. And then the second recommendation is just to consider diversifying the revenue sources into the problem gambling fund. As I talked about earlier, there's been tremendous growth in the amount of money that's gambled on sports legally in Maryland, but that doesn't contribute anything to the problem gambling fund that helps people with a gambling problem get treatment. And as in the future, it's possible that there are other forms of gambling that will be legalized in Maryland. And we think the General Assembly could consider revenue sources beyond just slots and table games. That concludes our presentation. Thank you for having me, and we're happy to answer any questions you have.
All right. If you have any questions, any members of the committee have questions, please raise your virtual hand and we'll call them in the order that we see them. I'll start off with some questions to the point that Mr. Powell just made there at the end. So just to be clear, the current problem gaming fund is almost entirely funded on the back of table games and slot machines and casinos, right?
100%, I believe.
Okay.
And most of that is on slots.
Right. And so, I guess based on the chart that you were showing on slide 4, where currently revenue for traditional lottery, say, is around 2.5 million, and casino gaming is increased to 1.5 million, or sorry, these are billions. That what you just said with mobile sports betting, of which 2023 is the first full year for mobile sports betting, the revenue from mobile sports betting is literally off the charts from the slide that you showed earlier.
Sure, I'm not sure.
Expected to be $3 to $4 billion.
Sure, my projection, it's been 3 billion through September, and that's with December of 2022 included, maybe a couple of days in November of 2022. And if you project that out through the end of the year, and I'm not taking into account that it's now football season, which I think is probably a driver of a lot of sports betting. But it looks like it'll be about $4 billion, give or take a few hundred million.
So $4 billion in revenue for mobile sports betting just this year, when it looks like casino gaming's only had $1.5 billion in revenue, right?
That's correct.
So that's a huge disparity. I mean, it seems like that's, incredibly concerning, where our problem gambling fund is being funded entirely by casino games, table games, and slot machines. And if more people utilize mobile sports betting, doesn't seem likely that casino revenue will reduce, and potentially the amount of funding going into our problem gaming fund will go down.
I think we will have to see the 2023 data to be able to, although maybe the center folks have a better sense of that. So I'm not sure if the money gambled on sports is taking away from money that's gambled at casinos, but I think if it's true, we'll see that when 2023 data is complete.
So that has huge implications. And I think it's important to also be clear that mobile sports betting is not including iGaming, right? So mobile sports betting is just betting on sporting events that are going on. iGaming, which the General Assembly has not passed yet, includes things like internet slot machines, right? So internet gaming is a whole untapped market that has not been opened up yet. Is that right?
That sounds right. I'm vaguely familiar with iGaming. We are backwards looking, so we're only really evaluating things that have happened. And iGaming, as you pointed out, is not legal in Maryland as of today.
Right. But there has been legislation introduced to open up the state to internet gaming, and I just want to think this through, that the implications of that could be tremendous. It's going to cut potentially into the casino industry, which is where most of our funding for the problem gaming fund is currently coming from. And to your point, I guess one of your recommendations is diversify the revenue sources, which could be all the more important because it's relying on an industry that could be dying. When you look at the revenue coming in from casinos, eventually maybe constricting as a result of, as we're seeing, an increase in mobile sports betting and potentially internet gaming occurring later on. So I think your recommendation to diversify sources would mean that some proportion of the funding should come from either mobile sports betting, which it currently doesn't, or potentially internet gaming if it actually comes to fruition through future legislation, that we'll need to look at those sources if we were wanting to expand resources available for the problem gaming fund.
I think, and maybe the center can speak to this, but I think there's also the possibility that different forms of gambling are more likely or less likely to lead to compulsions and addictions. And so it's possible that sports betting or iGaming or something else, it generates more problems than other forms of gambling. I don't know that that's true, but that would certainly be something to take into consideration.
Yeah, and I think that's a good point. And thank you, Mr. Powell, because I think that also brings home the fact that, you know, why we're seeing an exponential increase in mobile sports betting is that it's much easier for people in all likelihood to sit at home and engage in gambling than having to go to a casino to do this. And if you were to open up, you know, more internet gaming, the equivalent of slot machines on your phone at home, you know, it will probably lead to more Marylanders experiencing problem gambling, as well as a reduction in revenue at our casinos. So there are a lot of implications, I guess, from what you're saying. Certainly a lot for the committee to think about, and also for the General Assembly moving forward. I see there are a few questions here. Let me turn it to my co-chair first, and then, you know, we'll go to some of these other questions.
Thank you, Senator Lamb. Really, the only question I had for you, Mike, was just the one thing that stood out to me in the evaluation is we have a really large number of people who are considered chronic gamblers, and a very, very small percentage of them receive help. I'm just kind of curious, in your evaluation, is that typical compared to other states that have a similar infrastructure to us?
It's a good question, and unfortunately it's difficult to know because most states don't conduct a prevalence study. So many states, they haven't the slightest idea how many people may have a gambling problem. Maryland, you know, has done that prevalence study 4 times, and I think by law will continue to do that on a regular basis. So it's difficult to compare ourselves to other states. I will say that the numbers I've seen are generally in line with numbers that I've seen in the United Kingdom, where sports betting at least has been legal for a little bit longer. And I think the other prevalence studies or sort of academic research would suggest that Maryland is, like, the numbers in Maryland are what you would expect to find in a lot of other places.
Great, thank you, Mr. Pell. Senator Lamb, you wanna call on your side?
Sure, or we could go in the order that we saw the hands pop up. I saw,
Sure.
well, Senator Reedy had his hand up first anyway. Go ahead, followed by Doug Johnson, then Senator Hester.
Thank you, Mr. and Mr. Co-chairs. And this was a very good presentation. I'm very interested in this issue. It's the $4 billion jumped out at me, like probably it jumped out at everybody. I'm not surprised that it's large. I was a little surprised it's already potentially as much as $4 billion for a year when you compare it to our casino gaming. And I think it speaks to an issue we all need to get our arms around. And Senator Lamb sort of talked a little bit about that, so I won't repeat what he said, but that's a huge amount of money. When I think about the endless hours and hours and years we spent figuring out marijuana legalization for an industry that may only end up maxing out at $900 million to $1 billion in a best case scenario, we think, on recreational marijuana. We spent so long on that regulatory structure and how we're going to make all that work and all the side effects of it. With gaming, we've sort of plowed ahead here on online gaming. And I wasn't really against us doing it. I think it's better that we know what's happening as opposed to things happening under the table. But can you, I guess my question is, do we see that $4 billion, is that a stationary thing, or do we think that's going to go even higher? And then sort of a follow-up question would be, looking at the provider counts of who's providing services, it sounded to me like we're talking about people who basically provide the service and are just reimbursed. Are there other services out there that we may need to look at the state offering subsidies to? I'm just trying to think, how do we meet I think there's going to be a lot more demand with online sports gaming. I literally don't do it because I have an addictive personality. I just do. And I know I would get into it. And the worst thing that would happen is I would gamble and win some money and then I would keep doing it. So I don't even do it, but I know a lot of people do.
Well, and I'm the same as you, Senator. I will say I think your first question, I'm not sure if that curve will flatten in the future. I will point out that a lot of that money, it was free money that was given to people for signing up for an account. And so I don't know if that goes away at some point. I'm not privy to whatever the casinos are thinking about their promotional stuff. And two, the treatment stuff, that might be a better question for the center after they get a chance to talk about the report a little bit. But I think the growth in treatment providers is positive. They are in all the regions in the state, and more of them are offering telehealth visits. And so I think the center might be able to speak to whether the capacity is there to handle everybody that may need treatment.
Senator Reed, any other questions? You good? All right. Delegate Johnson.
Thank you, Mr. Chair. Mike, thank you for the presentation today. This was helpful. Are you aware of Pennsylvania, who have been doing online gaming longer than Maryland, the study that just came out from Pennsylvania?
I have not seen that.
I skimmed over it. I noticed that 1 in 10 Pennsylvanians participate in online gaming. My question is, as I've gotten deeper into this, my question is, what is the benefit to Maryland? I see that there's a lot of international corporations running this online gaming and iGaming, and it's very hard to regulate. And they have some data in the Pennsylvania study that I have not gotten in depth in, but it's looked like a pretty high percentage of people that experienced addiction. So when I weigh the benefits to Maryland, and as our casinos take a hit, then we have a loss of jobs, a loss of revenue from the casinos that directly come to Maryland. I'm a little concerned about the info that I'm reading and how it's going to benefit Maryland.
Sure. I'd like to take a look at that Pennsylvania study. I appreciate you bringing it to my attention. And I'll just say, our focus, what we were asked to evaluate was the center and how efficient and effective the center was doing. So I've not looked into, the benefits of sports wagering to the state of Maryland. But it's a valid question to ask.
Thank you. And I because Senator Reedy raised some concerns that I think are addressed in that Pennsylvania study that we might want to look at before we plow forward and pass something that's going to be more of a detrimental effect to Maryland than a benefit. Thank you.
Thank you, Delegate Johnson. And you bring up a good point that, when it comes to jobs in the state too, there could be an impact. One could imagine that because of all the discussion here, we should, examine what the surcharge on internet gaming should be if this were to proceed forward to support the problem gaming fund, because the overhead on iGaming is so low, right? Once an app is developed, it probably only takes a handful of people to maintain, and the rest of it is straight revenue. So there's no overhead when it comes to internet gaming compared to a bricks and mortar casino operation.
That's correct, Senator. And these are good paying jobs. These are usually union jobs, $75,000 a year or more. And that has a ripple effect, when you talk about then the spending that the folks that work at these casinos spend, the sales tax that comes to revenue that comes to Maryland from their spending. So I think we really need to slow down and take a good look at this.
Got it. Thank you, Delegate Johnson. Senator Hester.
Thank you, Mr. Chair. My question for Mike is on the kind of the nexus between the addiction, that we can see with gambling and the addiction that we can see with social media and the algorithms that kind of feed people what they want to see. This is something I've been really concerned with, especially with our young people. And so I've got a two-part question. First of all, do the services that the center, and the state services at the center provide address kind of this nexus between online addiction and gambling addiction? And if not, should they? That's my first question. And the second question is, do any of our regulations around advertising of gambling, do those portray, do those map to, the online advertising that we see, and especially these algorithms that can be so addictive?
They're great questions. I'll do my best with those. I'm gonna, and maybe the center is better to speak to this. I believe that their peer supporters and the therapists that treat people who have gambling problems, I would say sort of meet those people where they are. And to the extent that there's a nexus with sort of online behavior, I'm sure they deal with that. We're also aware, I don't think it was in the report, that the ability to bet on your phone has taken what designers have called gamification. So with, kids have grown up, my kids have grown up, playing games where you're incentivized to keep playing that game for longer amounts of time. And what I've read suggests that is incorporated into these mobile apps to be able to bet on things as well. And so it's certainly a concern. It was not something we talked about in our report, since we were focused on the center and what they were doing. But we're aware that other people have identified that as an issue. And then our advertising regulations, I'm not sure if I'm the best person to speak to those. I apologize, but I think it's relevant to look into.
Thank you, Mike. Mr. Chair, if we have the center on, could they answer the first question? Or are they not on?
I'm
They
here.
are on. They're actually going to be the next folks talking, but if you want to go ahead and take the question right now, go ahead.
Can you hear me?
Yes.
Okay. I'm Mary Drexler. I'm the director at the Maryland Center of Excellence on problem gambling. Could you just repeat the first part of the question? I was so intent on listening. Do you mind, Senator Hester?
No, I'm just trying to understand, if we look at the nexus between addiction online with these algorithms and the addiction to gambling, if you guys get a call from somebody who says, I'm addicted to my phone, I can't stop gambling on my phone, are you able to serve them appropriately?
I think we are. I think a lot from the training that our treatment providers have, and especially our peer recovery support specialists, of which we now have 5 on staff, they really, as Michael said, meet the person where they're at. So if this is an issue for them, then they will work through that. That obsession with being on the phone, betting on the phone. So we are addressing it. I think we have more work to do on even the gaming to the gambling piece, which we are starting to do now, especially with our youth. I think one of the things we've seen most recently in the past year with sports betting online and mobile is that accessibility and convenience has really pulled in a very young demographic. We are getting many more, several more requests from college age youth and from the parents of college age youth, because they found out that a son or daughter has lost their financial aid based on gambling, even though they may not be 21. Because even though we've legalized it in Maryland, there are still ways to gamble or sports bet that are illegal that a lot of college age students know about. But I think, we are there. My biggest concern with the online and mobile and the potential for iGaming in the next session is we're moving so fast that we don't see the full potential of the sports betting yet. We are seeing an increase in call, texts, and chats that come in to our helpline. We're definitely seeing the demographic change to a younger adult population, especially male, minority males. Increase in requests for people wanting us to do presentations. And we want to do more. You had talked about the outreach of public awareness. We want to do so much more with public awareness campaigns and keep them going throughout the year. But we don't have the funding that the sports world has that can spend millions and millions of dollars to get the message out on betting. We want to do more so we can and have increased funding so that we can do better at letting Marylanders know where the resources are that can help them, because that may bring in more people to access help. I just wanted to add, I think what we need to remember is problem gambling is a public health issue, and we need to start treating it as such, like we do with substance use, tobacco, suicide prevention efforts, problem gamblers have the highest rate of suicide among all the addictions. So all of those things we need to start doing. And in my verbal conversation, you asked about other states. Those that have taken the path of online and mobile and even iGaming, there are about 6 states that have done that, are saying we need to find ways to more sustain funding, because as the future moves forward, we're going to see more and more problems. And what Mike had alluded to in our evaluation was we need to seek it from the online. We didn't get anything when sports betting went mobile and online as additional funding. We want to make sure, and I'm not necessarily for it, iGaming be considered, that there is a mechanism to get a percentage of funding from the overall revenue of either sports betting or iGaming to come to the center. The casinos have taken away some slots and table games when online mobile came, because more people were sitting on their couch gambling than going into the casino. So there are a lot of factors that I think I just want you all to be aware of to help
Right.
Marylanders.
Yeah, and that was a point that we were making earlier too, that the only, just to be clear for the committee, the only source of funding, the Problem Gaming Fund, are really coming from table games and slot machines. And there could be a lot fewer people coming to our casinos if they can sit at home and play on slot machines and table games virtually. And that could have a significant impact, not just on the casinos themselves and pull the carpet out from under the casinos when they've been around for just over a decade, but it also could have a significant impact on our Problem Gaming Fund. Thank you. Senator Hedelman?
Thank you, Mr. Chairman. I have 2 questions from Mike, and thanks for the presentation. One is the former Ms. Drexler just talked about the changing nature of gambling, and I'm wondering if every 5 years doing a prevalence study is enough, given how quickly things are changing in the landscape. That's the first part of the question, just so we can have a sense of how many people are becoming addicted as a result of these changes. And the second question is looking at the allocation of the funding to the center and their spending on advertising and research and clinical work. I'm wondering if you, as an evaluator, looking at those, how they expend their funds, whether that is an appropriate kind of division among all those different expenses. If you can comment on that.
Thank you, Senator. Sure. And to the second question, internally, so the 4.7 million or whatever that amount is, BHA internally budgets how they're going to divide that money up. And maybe some years more of it goes to public service announcements and more of it goes to other places. Whatever they have internally budgeted for treatment, I know they've never exceeded that budget. So they've always had enough money to treat anyone who needed it. And I think that's good. And I think there's a possibility that there's going to be growing demand for treatment. But I say that with the awareness that the preference would be for people to not need treatment in the first place. And so if there are public service announcements or advertising and maybe the peer support before somebody gets to a point where they might need to, seek a medical professional or a therapist, or if the voluntary exclusion program, which the center and the health department don't run, but if for some reason, that was expanded, I think that would probably be the best investment to hopefully not need treatment in the future for people that get that kind of earlier help. And then to the frequency of the prevalent studies, I think the center has a plan for that and to do them more frequently than 5 years. I think 5 years is what's required by law. They have done it more frequently than that. And maybe Mary's the best person to speak to that.
Yeah, the plan is to do them every 2 years. So there was a 22 study. There will be one conducted in 2024.
And I'll point out that one should be, to me, pretty interesting because 2022 was the year that right at the very end, mobile sports betting was legalized. And so it's basically a picture of before. And in 2024, you'll have it after it's been fully functioning for 2 years. So, it might give us a sense of what that has changed.
Thank you.
Just to follow up on Senator Hedelman's question, Mr. Powell, you make it sound like the portion of the $4 to $5 million that's being utilized as part of this fund is actually being designated by BHA. Is that right? Or how much of it is going to the center then?
So it's just a budget thing. So the money that actually goes to pay for the treatment doesn't, I don't believe, technically goes to the center. That's money that BHA reimburses providers with. The rest of the money goes to the center for all the other things that they do.
And then I think to follow up on Senator Hedelman's question then is the proportion, when you look at the proportion on that slide, which I think was slide 3 of your presentation.
Yeah.
It looks like there are years where over half of the fund is being spent on research versus like clinical and treatment. What's your interpretation of, is that an appropriate proportion that's actually going to research versus actual services or interventions for people?
The amount that they spend on research, so they don't do a prevalence study every year, but they do a number of other research projects over time that I believe are valuable. They have not exceeded, like I said, everybody who's needed treatment has been able to get it and have it paid for by the Problem Gambling Fund. And then as far as the peer support, I believe that the center has the ability to provide peer support for everybody who needs it, and that the BHA also has the flexibility to sort of adjust that budget as needed if there was more demand for peer support, or if they wanted to run more public PSAs, or if they found they needed to spend more on people getting treatment with a therapist.
Got it. Okay. I think it is interesting that, the fund only has $5 million and we're spending half of it on research when the number of folks that are gambling is probably skyrocketing. It probably begs the question of, is there sufficient funds in there? If that much needs to be spent on research, are we able to allocate more at some point in the future if we have additional funds for the clinical and the treatment services?
I believe within the overall budget, they have the flexibility to adjust how they spend that money. Is there a scenario where there's just not enough money to provide treatment or prevention services to people? I guess it's theoretically possible. I don't think we're there yet.
But it begs the question that there are very few people that are seeking treatment, right? Out of that skyrocketing $4 billion being spent on mobile sports betting revenue, I think your report said that there were only 1,000 or a few hundred people seeking actual treatment. Is that right?
Through the state, sure. And that doesn't count people who might get help from a place like Gamblers Anonymous.
Right. Okay. I had a follow-up question on one of your recommendations on the voluntary exclusion program. The program, the VEP program, correct me if I'm wrong, does not coordinate with other voluntary exclusion programs in other neighboring states, right? So if someone is on our VEP list, which means that they go into a casino and the casino blocks them from being able to participate in gambling because they're on a list that they voluntarily submitted their name to say that I have a gambling addiction and should not be gambling, that list is not coordinated with neighboring states. So if they end up going to Delaware, or if someone's on Delaware's exclusion list and comes to Maryland, they can still gamble, right? There's no coordination of those lists across state lines.
That's my understanding, but I think Mary will correct me if I'm wrong.
Yeah, it would depend. Caesars, which is here, that oversees Horseshoe, they have a policy: if you exclude from Caesars in our state, you cannot enter the gambling floor in any of the other properties they own. MGM has a similar policy on the gaming floor when you voluntarily exclude from here. So it depends on the ownership of the casino, the brick and mortar casino, on that self-exclusion. It's going to be more difficult now that we're online and mobile and, sharing of data. But we have found, we've tried in the mid-Atlantic states at one point to have this kind of shared voluntary exclusion data, and many of the states did not want to do it based on their state's regulations. So we kind of went down that road at one point. But the best we have now is if it's a particular casino owner who has a property here in Maryland, they then will exclude them. Not all of our casinos do that, but some of them do exclude
I
them
see.
from other states.
That's interesting that other states, neighboring states, have a reluctance to do this. Since Maryland is a smaller state, it's not hard for residents from neighboring states or from our state to cross state lines to engage in gambling. And so that's a real
Yeah,
concern too.
it's been about 3 or 4 years since we tried it. Now with the move to more online and mobile, it may be a time to reconvene that discussion.
But at the same time, you're saying that it may be more difficult to actually
Yeah.
police
To
that, so
monitor
speak.
that, yeah,
Because it's all mobile at that point.
yeah.
Okay.
So Senator Land, I'm just thinking in the interest of time, why don't we give Mary and Robert and the folks from MDH an opportunity to just give their presentation, and then we'll open it up to a last round of questions. So I know we've got two other presentations to get to. Mike, thank you very much.
Mary,
All
can
right.
I just introduce people
Sure.
just so
Yes.
that the committee's aware? My name is Rob White. I'm with the University of Maryland Department of Psychiatry, and we are the group that is managing the program for the Department of Health. And our medical director and PI is Dr. Chris Welsh. He's an addiction psychiatrist, highly experienced in the treatment of a variety of addictions, and provides all of the clinical oversight that we need. And then Blair Ennis is with the University of Maryland School of Law. She's helps us with governmental affairs. And I also see our partner, Mary Vigiani from the Department of Health is present as well. So we're very pleased to be here. And I want to compliment Mike and his team on a very professional evaluation. Thank you.
Okay. I just want to thank you, both co-chairs, for allowing us to have a few minutes today. I think actually Michael has kind of talked about a lot about what I was going to talk about in answering your questions, but I want to thank the Office of Program Evaluation and Government Accountability under Michael Powell's direction, because I felt it was a comprehensive and fair evaluation of the center. They work closely with me, they work closely with our staff and our partners in the community to fairly assess the work that we do. I think he briefly hit on, and I wanted to briefly hit on everything that the center is charged to do. Our mission is to promote healthy and informed choices regarding gambling and problem gambling. We oversee the state's helpline, which is really the key point of access for people to get help, not just for the gambler, but their family members. And we also educate Marylanders about the risks through our public awareness campaigns. As I said earlier, we'd like to do more advertising to kind of counteract, especially now with mobile and online sports betting, to let people know more about where to get resources. Sometimes with more limited funds. We have a bit more funding this year, but we can't run a campaign throughout the year. And we see a rise in calls, texts, and chats as soon as we're doing some public awareness campaigns. People reach out. The numbers go way up in those months that we do more of that. We also maintain a directory of all those treatment providers who have experience in problem gambling now and training from us. That are willing to participate in the no-cost treatment that the state is offering. And one of the things that I think is really important about our program is the peer recovery support piece. We currently have 5 peer recovery support specialists. They're all certified here in the state of Maryland. We find that most people who call the helpline want to talk to them before they want to go to a treatment provider because they have lived experience with gambling addiction. My issue and the reason for seeking some additional funding is we have 5 and currently they are dealing with 787 active clients. We've seen about 1,400 come through and some of them are now inactive, but that's a lot of people. And we find that the southern region down near MGM tends to get more people that end up calling for help, but it would be nice to expand the number of peers we have within our program. We offer prevention services. We do what we call letters of agreement with community organizations. So if Asian population is at a higher risk, or young African-American males, we're working with the HBCUs. We're working with an agency, Asian Community Center, because they're the best people to outreach in prevention to those. So we provide them with that support that they need to do it. So even with all our partners across Maryland, online and mobile gaming is creating, I think, I don't know if I want to call it a burden, but it's certainly stretching the resources we have currently. Again, it's a public health issue. Relying solely on the casino table game taxes and BLT taxes isn't going to carry us into the future, isn't going to allow me to expand our public awareness, to expand some of the staffing needed. Right now, I have one prevention manager who covers the whole state, one clinical manager who covers the whole state. So it's a bit overwhelming for all the staff. So my recommendation, and I think it was brought out in the evaluation, we need to diversify that funding so that we can continue to keep up with the pace of what Marylanders may be dealing with in the future. Thank you very much for allowing me to speak. I don't know if any of my workers would like to say a few words. Or
Thank you, Ms. Rexer. We also on the agenda have Mr. Rob White.
Yep.
Were you here for to present anything or just to help with questions?
Just to support Mary's testimony, and just to add to that, as Mary has said, this is a public health problem. We've brought gambling into the state for many reasons that are all good reasons. Certainly better to have it legal than illegal. But I think when you look across the board, there are three main pots of money that are coming across. The casinos are in the neighborhood of 700 million a year. The lottery's in the neighborhood of 700 million a year. And sports gambling, as Mike said, is 25 million and growing in terms of the contribution to the state. So only the casinos are making any contribution at all. So that means 700 million from the lottery and another 25 million that's growing on the sports side. And that doesn't include anything in terms of iGaming. So it seems to me that a more rational approach would be to just say 1% of whatever's going to the state would go to the problem gambling fund. So that's the message that we're trying to get across. Thanks.
All right, thank you.
We also have Mary Vigiani from the Department of Health. Mary, do you want to offer anything, present anything?
Yes, I just have very brief comments. My name is Mary Vigiani. I'm the Deputy Director for the Service Access and Practice Innovation Division at the Maryland Department of Health Behavioral Health Administration. The contract with the Center of Excellence resides in our division under the direction of Laura Burns-Hefner, who is the Director of the Office of Problem Gambling and Suicide Prevention, and she could not be here today. We appreciate the opportunity to provide brief comments. BHA and MDH has reviewed the audit report in detail and agree with the recommendations. Regarding the first, BHA is current with all required report distributions, having provided the 2020 and 2022 prevalence reports on September 27th of this year. For recommendation 2, the Maryland Lottery and Gaming Control Agency did agree to include the Center of Excellence help seeker information on the voluntary exclusion program application. This includes an opt-in for the applicant to be contacted by the center if they would like further assistance. For recommendation 3, we have had initial conversations and expect further discussion regarding diversification of revenue sources. For recommendation 4, the center has revised its website to allow health seekers to include the no-cost provider network using additional filters and criteria. Recommendation 5, BHA is working with the ASO to provide the center with a regularly updated list of the behavioral health providers to accept Medicaid. And last is recommendation 6 of the report. BHA agrees that the ASO should regularly provide updates on treatment service claims for problem gambling to facilitate our oversight of capacity and spending for treatment services. This has been a challenge for the ASO, and we continue to press Optum for regular updates. That concludes my comments, and I'm available for questions.
All right, I see a question from Delegate Palakovich-Carr. Go ahead.
Thank you, Mr. Chair. Thank you for all of our guests for being here today. And I just wanted to say to Ms. Drexler, I appreciate you lifting up the issues around funding for the center. And I especially noted out of the evaluation that the region that I represent, which is part of Montgomery County, only has one peer recovery support specialist that it shares with 5 other counties, which I think collectively are about half of the population of Maryland. That one person is responsible for it. Seems like quite a lot. Well, I just wanted to ask one question, and this is for any of the guests here today or folks from DLS. In regards to the recommendation for the voluntary exclusion program from changing from an opt-in to an opt-out for referring to counseling services, I believe ultimately that's going to be up to Lottery to make that change. And I wonder if anyone has had any conversations there and to see if they are receptive to doing so.
Well, this is Mary. We have had a conversation with the Maryland Lottery and Gaming Control Agency, and they determined at this time that they would prefer to leave in opt-in and not do opt-out. So I did ask why that would make such a tremendous difference. There were a couple of rationales. They feel that they're doing more than other states are doing already, that most states don't have even this option to contact like their sender or their affiliate in the application. And also they were afraid that people might forget to check it if they want to opt out. But at this point in time, and it's not that we're not going to continue to pursue it, they have chosen not to do that.
Well, that's somewhat concerning. I think that seems like a pretty straightforward, easy fix. So Delegate Palakovich-Carr, thank you for asking that question. I think that's something the committee will probably have to take a really serious look at. I did just have one question. And actually, Senator Hedelman, I was going to give you and Delegate Wilkins a shout out for your bill. I know a number of us had some concerns on the university system and some of our individual campuses signing contracts and sort of incentivizing sports betting to come onto campus. And again, Senator Hedelman and Delegate Wilkins were real leaders on that last year with their legislation. I was really concerned, Ms. Drexler, over the increase in the number of young people. I'm just kind of curious to hear from you. Do you feel like the university system, our campuses, public and private, are doing enough, given the increased prevalence, and I'm sure the next study will really show among young people, particularly on college campuses. And I think Senator Freihester really, I appreciated her question on the nexus between addiction to phones. It's something that we're trying to tackle in other legislation as well, and the nexus with online gambling.
Yeah, I believe we're starting to make better inroads with the colleges and universities across the state as it relates. I think they've done great with substance use and other mental health issues. They're just starting to incorporate gambling. We recently did some letters of agreement with each of the 4 HBCUs, primarily because we're seeing a younger African-American population who are engaging at the college level in gambling activities. So they're receiving some of our funds so that we can help them in prevention efforts. And we're even looking at a survey across all 4 of those campuses on seeing what's going on with sports betting in particular. And many of the campuses now actually have esports as actually part of the campus activity. And we know people are betting on those games, those gaming. So we see that as the future. I think there's more work to do, but I think we're there. We're working on it. It's increasing. And it became even more visible to us as things are going online and mobile.
Thank you. Senator Hellman, go ahead.
Thank you. Thanks, Mr. Chairman, for the shout out. Ms. Drexler, I'm a little surprised about the opt-in and opt-out pushback too from the lottery. Can you tell me kind of what the difference to them would be, and then how and what sort of nexus you have with those folks? And if it is none, then it's none.
No, I have a very positive working relationship with the Maryland Lottery and Gaming Control Agency. I work continuously. We are part of MARG, the Maryland Alliance for Responsible Gambling. I work very closely with their responsible gambling director in the lottery. She is a great resource. I have worked with the executive director, John Martin, and we are working with them as they go for certification as a lottery with the National Council on Problem Gambling. I don't have more detail. It was very brief when I asked for the opt-in and the opt-out difference, because I have to say with the opt-in, we are getting 8 or 10 people a month that are opting in to get contacted by us. But I could see it being so much better if it just said the Center of Excellence on Problem Gambling will contact you to provide you with more support. If you don't want this, opt out. I would think that'd be better than saying, if you would like them to contact you. The only rationale I got was that we are already surpassing what other states are doing with our work together on the BEP application, and we don't want people to misinterpret the question and forget to check opt out. So, and this was very recent, within the last week or two. So, you know, I don't know.
Can you help me understand what happens if somebody opts in? Who reaches out to them? Is the first line the peer recovery specialist, or?
Yes. Well, what happens is when that's filled out on the application and they're opting in, the responsible gambling director at the lottery sends to my clinical director these names and phone numbers or emails. It's predominantly people giving us emails. We find out what region of the state they're in, and we give it to the peer for that region to do the reach out. So that is the peer that's making the initial contact from the center.
Great. Thank you.
You're welcome.
Delegate Johnson.
Thank you. And this question is also for Mary. If it was an opt-out situation, do you see that as increasing the people that you would contact, and would you have the resources to keep up with that?
I think it would probably increase the individuals that we would be able to contact. And yes, we probably need more resources to actually keep up with that down the line, especially with more online and mobile betting that's going to be happening. So yes, my answer to your question would be, I think some of the concern also of the lottery was, you know, there's an anonymity that is part of the voluntary exclusion program. So if they mistakenly don't check that off, then, and they get a phone call from us, that is kind of breaching what they're thinking is their anonymity when signing the application. So that was another point.
Thank you.
This question is for Ms. Drexler. Are you getting all the data that you need from the ASO? And if not, what do you find as the biggest impediment to that? Why are you not getting all the data that you need?
Yeah, I think, you know, I'll defer some of that to BHA, but we do have monthly meetings with the ASO, of which I am included, and so is my clinical director, to kind of make sure that the information on problem gambling and being able to access the problem gambling treatment fund, which is at no cost to the caller, because there have been some instances where there's confusion when the individuals who are on our provider network list have not been able to get the reimbursement in a timely manner, but we are working through that. But I think I'm going to leave it to, I don't know if there's anything else that BHA would like to say about, because they directly contract with the ASO. They're not part of my contract with the ASO. So I don't know.
Gianni, do you have anything you want to add?
Yeah, I'll just kind of mirror what Mary said. We meet with them with the ASO monthly. We've been trying to get certain data reports on demographics of who is getting treatment and different information from them with limited success, I would say. And we just continue to press them for regular updates.
Okay. Well, the ASO is a client of the department, right? So encourage the department to really kind of weigh in to get the data that's needed for the center and to better inform how we move forward with our programs in the state.
Senator Lamb, I was just going to jump in. I mean, Ms. Vigiani, I would assume you have a contract with the ASO. Does that contract specify specific data sets and information that MDH is supposed to receive regularly?
A contract with the ASO doesn't sit with the Behavioral Health Administration in particular, so I don't know the details. I just know that I don't think we're the only folks that are having difficulty getting our needs met from the ASO.
Do you know who the contract sits with?
I want to.
I believe it's, I don't know for sure. I think it's Medicaid. I could get that information and get it back to you.
But either way, it's within MDH.
It's within MDH, yes.
Yes.
Okay.
Yes.
Maybe we'll have some.
I'm just saying, I don't personally oversee that contract certainly, and I don't know exactly who does, but I could get that information back.
If you could follow up with that information to answer Chair Solomon's question, that would be helpful.
Absolutely.
And then last question from me is, noticing from Mr. Powell's report that there's a significant lack of providers participating in the no-cost treatment program. It looks like there are only 128 providers that are in the network, and most of them are concentrated in Central Maryland. There's like 18 counties that have less than 5 providers. Are there plans for expansion, or is that concerning that there's not a greater availability in other parts of the state?
We constantly try to get new providers in all areas of the state to join our provider network to offer the no-cost treatment. Part of the issue has been the reimbursement at the Medicaid rate. Some of them, especially as we branch out to private practitioners, not just workers within an organization, that they don't want to be reimbursed at a Medicaid rate. They've seen other states reimburse at higher rates. And I think the other issue has been, there have been some holdups with the ASO on the reimbursement process, and they don't want to deal with that. So we've actually have lost a few providers who were doing it, but it took so long to get reimbursed for the services to the problem gambling client. So there are issues with the reimbursement process through the ASO. We're working on them. They're getting a little better.
Okay, any other questions from the members of the committee before we wrap up? It sounds like there's a lot going on here, and we're really just at the tip of the iceberg when it comes to the proliferation of mobile sports betting, potentially internet gaming, and it certainly sounds like there are a lot of red lights that are blinking here that the General Assembly will have to take up in the future. Any other questions? Chair Solomon, anything else in your end? All right. Well, thank you all for participating in this part of the hearing. We'll move on next to the scoping evaluation of the Maryland Excels program. And for this, we'll turn it back to the Office of Program Evaluation, Mr. Powell.
Sure. Thank you, Mr. Chair. And we'll go as quickly as we can on these. And Eric, if you can make sure the first slide is up. So if you don't know what Excels is, it is a quality rating and improvement system. People call it a QRIS, that gives quality ratings to childcare providers in Maryland. It is voluntary to participate, but it is strongly encouraged. It's administered by the Office of Child Care in the Division of Early Childhood within MSDE. And the goals of this Excels or QRIS are to recognize quality providers, to encourage providers to increase their quality, and to provide helpful information to families. And with that, on this slide, I'm going to turn it over to my colleague, Tanya McNair.
Good morning, everyone. Maryland Excels rates providers on a scale of 1 to 5, with 1 being the lowest and 5 being the highest in 5 different categories. What you see before you is a snapshot of one of those areas: developmentally appropriate learning and practice, and a snapshot of what is required for levels 1, 3, and 5. So for example, to achieve a level 1 in this area, you do not need a developmental checklist. However, a developmental checklist is needed to earn a rating of 3, and to earn a level 5, you would also need a sample child assessment tool. Next slide, please. There are 3 different types of financial incentives for providers to increase their quality rating. 1, vouchers for lower income families that are only usable at providers with an Excels rating. 2, enhanced subsidies for providers with a 3, 4, or 5 rating. And what you're looking at before you are program bonuses that are available to providers who increase their quality rating. Next slide, please. Completed multi-state evaluations of QRIS have conflicting findings about the impact of QRIS programs on short-term child development outcomes. For instance, if you look at language and literacy, 4 studies show that there is no relationship between QRIS and child development outcomes. However, 2 states show that there is a positive relationship, and 1 state shows that there is a negative relationship. Next slide, please. The majority of Maryland Excels positions are contractual. There are, in fact, several employees that have been contractors since the program start. Next slide, please. There are 5 types of early childhood care and education facilities. Most of the child care slots that are available in the state are at licensed child care centers that take up roughly 72%. Next slide, please. The number of licensed private child care providers has steadily declined for family child care providers. This number has decreased from over 11,000 in 2000 to roughly 6,000 in 2017. Next slide, please. While the number of providers has declined, mostly family child care providers, the number of child care slots has risen. This has been driven by increased slots at child care centers. From 2000 to 2017, family child care providers lost 32,000 slots, while child care centers gained roughly 41,000 slots. Next slide, please. Between 2000 and 2017, 17 state jurisdictions lost child care slots. And with that, I'll turn it over to my colleague, Diana Winter.
Thank you, Tanya. So now we wanted to highlight a few of our findings about the actual outcomes of the Maryland Excels program. If you could, we're at the next slide, good. So first of all, since the program first opened to all licensed providers in 2014, the total number of providers actually participating in Excels and the participation rate among all licensed providers have more than doubled. Next slide. So participation in Excels doesn't actually require a child care provider to improve their quality rating over time. So if I were a child care provider and I started at the lowest rating, which is a level 1, I may decide that I can't dedicate the time and the resources required to move up to a level 2. And according to the program requirements, that's okay, as long as I continue participating in the rating. It turns out that a lot of providers who participate in Maryland Excels are making that calculation. So if you look at this chart, on the left-hand side, you can see the initial quality rating of a program, and on the right or across the top, you can see the last or the most recent quality rating of participating providers. As you can see, providers who start at a level 1 tend to stay at a level 1. Providers who start at a level 2 tend to stay at a level 2, and so on. The only outlier here is the quality rating 4. So if a program starts there, it means that they've actually already begun the process of getting accredited. And the only major difference between a 4 and a 5 is that they've achieved accreditation. So that jump between a 4 and a 5 is actually pretty small, whereas the jump between a 3 and a 4 might actually be much harder for providers. Next slide. So this is showing that providers who do continue participating in Maryland Excels over several rating cycles, they tend to improve their quality rating. So you can see that providers who start at a level 1, more than 3/4 of them have improved their rating to a 2, 3, 4, or 5 by the 5th rating cycle. Next slide. Thank you. This figure is just showing us the percentage of providers in each group who have the highest quality rating, so a 4 or a 5. And if you look at this pretty quickly, you can tell that there's a difference between family child care and larger facilities, such as a letter of compliance facility or a child care center. One of the major findings in our report is around the challenges facing family child care providers who want to improve their quality. As you can see, they tend to start with the lowest quality ratings and are much less likely than the other groups to achieve a 4 or a 5 during the course of their participation. We go into a lot of detail about why this is happening in our report, so feel free to read that for more details. And this slide is just showing us the tiered reimbursement. So as Tanya touched on, providers have to participate in Maryland Excels in order to accept a child care scholarship voucher. Providers with quality ratings of 3, 4, and 5 are eligible for higher reimbursements because of their higher quality ratings. If you talk to a lot of stakeholders, they shared that accessing tiered reimbursements is actually a pretty big game changer for them because most childcare providers are operating with pretty slim margins. So having the additional reimbursement can really make a difference in their ability to improve quality. But we found that a lot of providers who accept childcare scholarships don't qualify for tiered reimbursement because their quality ratings are too low, meaning they're at a 1 or a 2. All right. And finally, as Mike mentioned in the previous presentation, our evaluations are usually pretty backwards looking, but we thought it was important to dedicate a little bit of space in our report to the blueprint. So as you all know, there's an entire pillar of the blueprint legislation dedicated to early childhood education. And a lot of the provisions in the law are closely tied to the Excels program. The law expands public pre-kindergarten slots for 3 and 4-year-olds and requires all public pre-kindergarten providers to achieve the highest quality rating in Excels, so a 5, within 5 years. As of May 2022, only 30% of public pre-K providers were participating in Excels, which means that there's a pretty big influx of providers who are coming into the program under Blueprint. We also heard that there are a lot of providers who don't participate in pre-kindergarten, public pre-kindergarten, who are concerned about how this Blueprint requirement is going to impact their business. The expansion of public pre-kindergarten under the Blueprint is expected to draw 3 and 4-year-olds away from private providers, which might make childcare more expensive for younger children enrolled in private childcare, especially family providers. And while there are pathways for those family providers to participate in public pre-K, we heard from many people that the barriers to improving their quality and meeting those standards are really limiting in their ability to do that. So now Mike is going to talk about a couple of our recommendations.
Sure. Thank you, Diana and Tanya. So we had 7 recommendations. There are 4 that I want to highlight. One is that we recommended MSDE should report to the General Assembly on the sufficiency of their personnel structure, both the use of contractors and whether they have the people in order to accommodate any change in demand because of growth or because of the Blueprint. The second is that that they should see if there are additional pathways to accreditation for family child care providers. There are 12 acceptable accrediting bodies in the state, including one that Maryland ourselves provides. only one of those 12 actually accredits family childcare providers, yet accreditation is an important thing for family childcare providers, especially if they want to be considered a public pre-K. The MSDE is revising Excel standards and rating scales by fiscal 25, and we recommend that they update the General Assembly on the progress of that. We also thought by 2030, hard to imagine, so Excels and MSDE work, a lot of the money in Excels goes to Johns Hopkins to do a lot of research for them. And we think one of the things that they should consider researching is the impact of Excels and of higher quality rated childcare on long-term childhood development. That concludes our presentation. Thank you for having us, and we are happy to answer any questions you have. And
Right, we have sorry, go ahead, Mr. Powell.
I was just going to say, and I believe folks from Excels, the Division of Child Care or Childhood, and MSDE are here.
Yes, I think they're going to be presenting next, right? So if you have questions specifically for MSDE, we could take that after they present. Any questions? Delegate Smith, you had your hand up, you took it down. Anything you want to ask now? Okay, you're good. Seeing no questions, I think Chair Solomon, should we proceed?
Yeah, I think that's great.
All right, so we'll have the folks from MSDE. I think we have a few deputy superintendents, Ms. Collins and Ms. Lawson.
Yes, good morning, everyone. My name is Dr. Deanne Collins, Deputy State Superintendent for the Office of Teaching and Learning at MSDE. We did provide some slides to Mr. Pierce. We really appreciate this time. We'll use this opportunity to respond to pretty much the 4 areas that were just highlighted and provide some additional information. Before we get started, I do want to also acknowledge the other MSDE staff that are with us. I want to introduce my colleague, Dr. Sylvia Lawson, who's currently serving as an interim state superintendent of schools at MSDE, and she's also the deputy state superintendent for our organizational effectiveness. We also have with us Dr. Kayla Aileen, who is our executive director of government affairs, education policy, and external relations. And we also have Dr. Shana Cook, who serves as our assistant state superintendent for the Division of Early Childhood. Thank you all for this opportunity to provide you with an update of the work we've been doing. We can go on to the next slide. So this is just an overview of what we plan to cover. We know that our time is short, so we will be mindful of the time, but we're just very appreciative and excited to provide you with some updates around adequacy and sustainability, the pathways that we've been working on to support providers, an update on public pre-K, the opportunities that we've provided through our Growing Families program, the redesigning of Maryland Excels, which was mentioned, and how we are enhancing the integrated data systems, and then looking at how we are assessing the impact of the Excels program. So first, we wanted to talk about adequacy and sustainability and how we have prioritized the needs, in particular of staffing, to make sure that we are meeting the intent of the blueprint, because it's exciting times to make sure that we can be innovative and on point as we service our community. So we can go to the next slide, please. So in terms of the personnel structure in the Division of Early Childhood, this has really played a crucial role in supporting early childhood education in the community, especially with the community-based or private providers, and also our public schools. It really supports the birth through age 8 continuum and ensuring comprehensive education for parents and infants, and also through their elementary age as well as careers. The structure that we've put together also aligns with sort of the longitudinal structure that's necessary and to help provide a seamless transition from early childhood to elementary education. As I mentioned, this alignment is very critical to meet the innovation outlined in the blueprint and to support the early childhood education space. So in December of 2022, MSD appointed a new assistant state superintendent, Dr. Cook. And as also part of that restructuring, we divided the division into 4 distinct offices just to make sure we could streamline operations of the division. So we have the Office of the Assistant State Superintendent, who oversees all of the functions in early childhood. We also have the Office of Early Learning and Instruction, who plays a very pivotal role in the curriculum development and the standards implementation, designing, and support for early childhood. We have the Office of Family Support Services, who are dedicated to providing support and resources such as wraparound support to families and caregivers, also through our Patty centers and Judy centers. They've really helped to strengthen the partnerships between parents and the education system to create healthy environments and prepare students for kindergarten. And then we also have the Office of Child Care, which also is known as the acronym OCC, and they really support the work of licensing and regulating our child care facilities. They also house our child care scholarship program, which many families have taken part in, and they help to support financially with the various programs in the division. And finally, the Office of Child Care includes the quality improvement initiatives that we've instituted through the Maryland Excels and the accreditation program. The last thing I wanted to mention is that the division has taken a strategic approach to align our human resources to expand high quality pre-K programs, which includes the Judy centers and Patty centers. Maryland excels, redistributing the quality, we have redistributed our quality assurance specialists caseloads to make sure that they're more equitable and that we can provide hands-on support to our providers. This is a crucial role, especially licensing staff. We've conducted a comprehensive salary study. So we've been able to significantly increase salaries by about 12% for our licensing staff positions. And also our licensing staff positions, all licensing staff positions have been converted from contractual to permanent positions. So this makes them eligible for a full range of benefits that Maryland employees received. Also, in October of 2023, we welcomed just recently an executive director of operations, policy, and strategy to further enhance the capabilities in the division of early childhood. So we are continuing to make sure that every position is filled. We have brought on some high quality, high functioning staff that have really helped us to continue to enhance our programs. So I will pass it off to Dr. Cook to talk about some additional work that we've done. Dr. Cook?
Thank you, Dr. Collins. I want to talk to you all about recommendation 2 in the report, creating a new pathway for Maryland accreditation for family child care providers. Next slide. The Division of Early Childhood is actively working on creating more accreditation pathways for family child care programs. Currently, family child care programs can obtain accreditation through the National Association of Family Child Care, NAFCC, and we also have upcoming discussions with NAFCC leadership to explore new ways to improve pathways. Moreover, the National Association for the Education of Young Children and the National Early Childhood Program Accreditation have recently expanded their accreditations to include family child care programs, with both organizations being recognized by MSCE. In March, Maryland Excels initiated discussions with the Maryland State Family Child Care Association to gauge their support for a pathway within Maryland accreditation for family child care providers. The division aims to gather stakeholder feedback by the end of October from currently accredited family child care providers and those in the accreditation process who have access to the accreditation support fund, regarding the addition of a pathway for family child care providers in Maryland accreditation. This initiative reflects a commitment to improving the accreditation options for family child care providers in the state. This would ultimately lead us to having 4 different accreditation pathways for family child care providers. Next slide. In recommendation 3, MSCE was asked to provide a report to the Maryland General Assembly on public pre-kindergarten. Next slide. Annually on December 1st, MSDE provides a pre-kindergarten report to the Accountability and Implementation Board, or AIB. This report is publicly available and can be found in the link at the bottom of this slide. AIB shares this report with the Maryland General Assembly, and you can see in FY23, We had 43 pre-K grantees, 30 of which were private providers, and 13 were local education agencies. Next slide. Recommendation 4 focuses on removing barriers in the growing family childcare opportunities, or GO FCC pilot. The GO FCC program has expanded to reach every county in the state, we're proud to say, through the Child Care Resource Centers. Next slide. GO FCC is actively engaged in providing comprehensive support to individuals interested in opening family childcare businesses. They offer intensive training, coaching, and resources to guide potential providers through the licensing process while simultaneously helping them establish a strong business foundation and deliver high-quality childcare. Additionally, the imminent promulgation of the Individual Taxpayer ID Number, or ITIN regulation, is a significant step towards inclusivity, as it will facilitate the expansion of licensed and registered childcare programs to include newcomers, refugees, and immigrants in Maryland. We're very excited about this program and its ability to support the diverse needs of children and families in our state. Furthermore, we've allocated $23 million through the Maryland Rebuilds Grant to underscore our commitment to stabilizing the early childhood workforce with a specific focus on family childcare. This funding will support initiatives such as apprenticeship programs for early childhood educators, credit for prior learning, and alternative certification programs to further enhance the quality of early childhood education in Maryland. Next slide. Recommendation 5 highlights the need to redesign standards and rating scales in Maryland Excels. MSDE's Division of Early Childhood is doing just that in close partnership with early care and education stakeholders who we meet with weekly. As of September 2023, 80% of all licensed childcare programs and 56% of all registered family childcare homes are participating in Maryland Excels. This is one of, go back to the previous slide, this is one of the highest participation rates of any quality rating and improvement system in the country. As a reminder, quality rating and improvement systems, or QRS, were started to support the improvement of the overall quality of childcare programs. Next slide. The Maryland Excels bonus structure for FY24 focused on aligning family childcare and large family childcare homes with childcare centers and providing first-time published programs with an incentive to pursue higher quality ratings. Programs who publish for the first time a quality rating of 1 will receive an $1,000 bonus regardless of program type or size. This is an $850 increase from FY23. In addition, programs who publish a higher rating or maintain a rating of 4 or 5 will receive an annual bonus. This is one of the largest investments in quality in the country. This investment will drive continuous quality improvement. Next slide. Previously, programs were required to open and operate for more than 6 months to publish a quality rating higher than 1. We've removed this requirement, and now programs are able to publish as soon as they open at a higher rating. Next slide. In addition to removing the 6-month open and operating requirement, programs under provisional license status are no longer limited to publishing at a quality rating 2. This really supports early childhood providers in publishing higher ratings. Next slide. On March 17th, Maryland Excels removed the requirement for scheduling a validation visit for accreditation to meet the quality 4 requirement. So programs are able to publish a quality 4 rating at a much faster rate. Next slide. And this slide just highlights that we have a wide range of accrediting bodies. Currently, Maryland recognizes 13 different national accrediting bodies and supports childcare providers as they seek accreditation with the Accreditation Support Fund. Next slide. We've also changed our policies around the use of frozen fruits and vegetables with no additives. This revision has allowed childcare providers to meet higher ratings in Maryland Excels while purchasing frozen fruits and vegetables that last longer and are more affordable. Children are still able to access high quality foods for healthy development. Next slide. In recommendation 6, we were urged to create a better data system to meet the needs of the early care and education field. The Division of Early Childhood is currently using federal funds to support the enhancement of data systems to better support the planning, oversight, and evaluation of early childhood programs and services. Next slide. As of October 2023, this month, the division has taken significant steps towards enhancing data systems. We are streamlining processes, improving data automation, and ultimately fostering better data-driven decisions making and improving customer service. We've also identified key gaps in our data and are working to address those gaps. Next slide. MSDE is on track to meet the recommendation 7, which is to have an independent evaluation by 2030, excuse me. Next slide. It will be important to conduct an independent evaluation in the form of a validation study, which is the gold standard for QRS independent evaluations. The independent evaluation is critical, but its timing is contingent upon several factors. It will be essential to conduct a validation study once MSDE, in partnership with key early childhood stakeholders, has completed all standard revisions and systems upgrades, including the modernization of data systems, and early care and education providers have had time to adapt to the new Maryland Excels and Maryland accreditation standards. As of now, this independent evaluation is incorporated into MSDE's timeline, occurring once the revisions and systems updates have been fully executed. We are very excited to take this holistic approach to ensure that the evaluation is conducted under optimal conditions, taking into account all relevant factors and enhancements. Thank you for your time today, and MSDE looks forward to answering any questions that you may have.
All right, thank you. Any questions from the members? Delegate Blackledge-Carr.
Thank you, Senator Lamb. Question for MSDE, and maybe this is best directed to you, Dr. Cook. What is the current staffing vacancy rate in the Division of Early Childhood?
Yes, we are actively working on eliminating all vacancies. I can say this month, we actually have quite a few new hires joining. And I will say that overall, in terms of the licensing branch, we have no vacancies. In the Maryland Excels, which is now called Quality Improvement and Initiatives branch, there are 4 vacancies. And in the Office of Early Learning and Instruction, there are currently 6 vacancies. We're working to fill all of these vacancies. We've had large scale hiring processes and recruitment processes to fill all of these positions going forward.
Thank you for that data. And I'll just say in follow-up, I mean, the evaluation mentions about the relatively high number of contractor positions. I'll say I've been hearing from other programs outside of MSDE about, difficulty, especially in this tight labor market, of filling contractor positions. So I hope that's something that the department will be working on and converting some more of those positions to PINs going forward. Thank you.
That is absolutely what we're doing. Thank you, Delegate.
Delegate Smith.
Thank you, Mr. Chair. And also thank you to all of the presenters today. I was very encouraged to see the work that's been done to address some alternative pathways to accreditation for family, providers. I just had 2 questions related to those providers. One, do we track any type of demographic information about the owners of those family centers. I know anecdotally, nationally, they tend to be disproportionately women-owned businesses and disproportionately women of color and or immigrants. And then lastly, I wanted to know, in addition to that information, if it's something you track, if there are any surveys related to satisfaction in those centers of the parents and the families themselves. I'm just curious. I think there's a lot of tension in the implementation and the conception of the blueprint around quality, and sometimes the perception of quality from the perspective of the family may be a bit different than the perception of quality as conceptualized in the blueprint. So I'm curious to the extent you have data tracking parent or family satisfaction.
Those are excellent questions. I will say for family childcare providers, they are disproportionately women. We actually are gearing up to release a survey which will capture workforce data. We'll be able to capture demographic data, which will include race, ethnicity, language spoken as well of the early childhood educators. And we expect with the promulgation of the individual taxpayer ID number that we will have an increase in immigrant and newcomers to this country opening family childcare providers, which we think Go FCC, and we've talked with the Maryland Family Network, which is leading many Go FCC programs through the child care resource centers. They will be using that, they will be able to use that data to support families. And in addition, Child Trends is currently conducting an evaluation that includes parent perception of quality. We have been really pushing tools and resources to early childhood education providers on consumer education, so our families can know what a quality rating and improvement system is, what Maryland Excels means in terms of quality. There's also lots of branding that has gone out to childcare programs so that they can be proud of their quality rating level. So we're very excited about those two upcoming pieces. And then the last thing I'll say on this is some counties are conducting supply and demand studies. We actually have a partnership right now with Maryland Philanthropy Network to conduct a supply and demand study of birth to 5 programs in Baltimore City, for instance. We're hoping to create a toolkit so other counties can use use these materials to replicate the supply and demand study. And the supply and demand study does take into account what families want and what they're demanding of early care and education programs.
Thank you so much.
I don't see any other questions. I did have a number of questions. I'm sure that's not a surprise to the MSDE folks, given the long work we've done on this. I just want to start off by saying thank you for you all being here and for a lot of the work that's gotten into this. You all have done, I think, just so much over the past couple of years during COVID to, strengthen our childcare system. We're not quite there yet, but I know we're getting on the right track, and I wanted to just acknowledge that, particularly on the Go FCC program. That was a pilot in Montgomery County. It started as a program in Montgomery County. Then Senator King and I put a bill in, and our original bill only had 3 pilot sites in it. So just incredibly excited that MSD has taken it and expanded it far and wide. So I know Senator King and I are excited to see that report back at the end of this year and what additional actions we need to take. I did want to just ask a couple of questions. The first one, just to clarify, because I know there's been different language used in the OPEGA study versus, the change in naming of them. So just to clarify, those positions that were turned into full positions within from the contractual place, the 24 positions that Mike mentioned in his report, those are the ones that you have now turned into full positions, correct?
So we've changed the licensing branch primarily into full positions. We've made a request to DBM for additional conversions to permanent staff.
Okay. So those 23 that were outstanding in the OPEGA report, those have become permanent, or are those still the ones that are in the conversion piece or waiting?
Those are the ones in the conversion request to DBM.
Okay. I think that's really critical. And Mike, I just want to say one of the things that I always appreciate about the OPEGA reports are the surveys that you all do. And I think some of those quotes from staff talking about lack of morale and the difficulty. So I'm really appreciative that you all have started to make that conversion. And I think it's something those of us on the Appropriations and Budget and Tax Committee will keep a close eye on as we go into next year's budget cycle. Moving into just some other pieces, and I don't know that we have time to really get into this. Again, I know MSDE took some really amazing steps to shift the payment model, particularly for providers who are part of the Child Care Scholarship Program, moving from an invoice system to a prepayment model that's based on enrollment as opposed to attendance. Many of us, I think, particularly on this committee who are engaged on the early learning front, have heard from a lot of providers that there's still really terrible kinks in the system to work out. I mean, I'll just share, I heard from one provider that got a almost $30,000 bill or essentially arrears statement saying they owed MSDE $30,000 and are literally operating on a loan to keep their business afloat. And this is a really high quality provider that has been echoed over and over from other providers that I've heard from. So again, that was a monumental shift in the payment system, and that's not easy. I know there's been a lot of issues with the vendor, and the system that they use. So I just wanted to bring that up. I think several of us on the hearing today will probably want to engage in a meeting with that to kind of make sure those kinks are worked out. Because if we're not paying folks in the scholarship program, they're not going to participate in it, which I know is not what you want. That was not the reason for the monumental shift last year. So I just wanted to raise that. I guess on the other question, I wanted to dig in a little bit more on the blueprint piece, because I think that is probably second only to the budget issues that we have with the Child Care Scholarship Program that we're going to need to fill next year. And again, that's a good story to tell that we've increased enrollment quite a bit. And again, you all made really tremendous, I think the tremendously correct decision to invest a lot of our ARPA dollars, the COVID relief money, into increasing the reimbursement rates for providers and increasing the income threshold where families are qualifying. And we've gone from one of the worst states in the country maybe 5 or 6 years ago to one of the best. I think the other big issue again is how are we dealing with the blueprint? And so the OPEGA report talks about, we need another 700 or so, 500 or so providers, to meet our needs in the blueprint. And was curious if you could talk about, do you feel like we have the right level of structure and financial incentives and supports in place for providers to make the shift on the Excel standards? I'm hearing from providers that they don't feel like the support's there. Again, a lot of that just costs money, but in full transparency, can you talk about how are you getting providers to be part of the pre-K system? What do we still need to do? What kind of additional money do we need to allocate to those accreditation programs, to the professional development programs to get providers to come into the system?
Absolutely. I will just start off by saying a $30,000 bill or payment needing to be paid back to Child Care Scholarship is an outlier. Very few providers face that level of debt, and so I just want to make sure that that's clear in terms of the framing of the Child Care Scholarship Program. We have been implementing new processes and procedures, and we know change is difficult at times, and transitions are hard. However, we've had many office hours and worked with providers to help them understand the new invoicing system and support them with targeted technical assistance as they transition to the new approach, which is where the U.S. Department of Health and Human Services Administration for Children and Families is moving us towards advanced payment and presumptive eligibility. In terms of presumptive eligibility and some of the other policies that we've implemented, such as low co-payments and removal of child care support from the decision-making around eligibility criteria, we've had an increase in the number of children served, more than 30% increase from last year to this year. And then in terms of new child care providers joining the Child Care Scholarship Program, we've actually had an 11% increase from last year to this year, and it's continuing to grow. So we're excited about the number of child care programs who have opted in to the Child Care Scholarship Program. In addition, in terms of quality supports and incentives, we've created a new initiative in the Division of Early Childhood called the Push to Pre-K. This initiative will provide direction and assistance for childcare programs interested in submitting pre-kindergarten expansion grants for the first time in FY 2025. Our goal is to provide as much assistance as possible so that these programs can obtain pre-K dollars. For instance, some technical assistance and support sessions include understanding licensing requirements, identifying qualified staff members. In terms of meeting Maryland Excels requirements, we are helping programs with enrolling in Maryland Excels. We actually have, as I said earlier, the highest voluntary participation in Maryland Excels, one of the highest in the country. We also are supporting programs with increasing their quality rating to level 3. And we're also helping programs with grant writing. That's actually been a barrier, particularly for mom and pop family childcare programs or smaller centers. They don't have grant writers like some of our local education agencies do. And while we cannot assist programs in writing their grant proposals, the division wants to be a resource and share resources on grant writing. We have found many programs need support with grant writing, and our goal is to help remove this barrier to receiving funds. And then finally, I would love to talk about the pre-K capacity building grant. We recognize that the requirements of the blueprint programs need to help with building capacity to attain those requirements. So using American Rescue Plan funds, we started a grant program that allocates up to $10 million this year to funding local education agencies who may be serving 3-year-olds for the first time, for instance, and private providers who are needing support as they move towards the blueprint requirements. This capacity building grant provides targeted technical assistance, support with Maryland Excels ratings, support with enrollment in credential and certification programs. And we're excited about this sort of pilot grant program that we view as an on-ramp to becoming state-funded pre-K funds with blueprint dollars. And so we're excited to share those results from this fiscal year with the General Assembly, as we hope that every program that's participating in that pre-K capacity building grant is able to receive blueprint funding in the next fiscal year.
And Dr. Cook, if I can just add, Delegate Solomon, thanks for the question. Dr. Cook covered everything. Just want to reiterate that, as Dr. Cook mentioned, the percentages of increase are in double digits. So she mentioned that there's a 30% increase in the providers, as well as an 11% increase in enrollees. And because
Excuse me, Dr. Aline, it's the opposite. 30% in increase of children and 11% increase in providers.
Yes, thank you, Dr. Cook, for switching that for me. But really the message here is that we are seeing dramatic increases here in engagement in this program. More so that we're seeing that because we've been over engaging on MSDE sides to make sure that parents and families are aware of this program, we're seeing that income eligible families are applying and they're seeing ease of access to this application. So we are enrolling at a faster rate. And because of that, we are expecting, over time that there will be an increased demand in the appropriation. So we are working with the governor's office, we're working with DBM to make sure that we are prepared as far as appropriations to continue the growth trajectory of this program. And so we will have more information to the General Assembly very soon. But like I said, this is a positive problem to have. We have such an increase in enrollment that we see that folks are engaged in this program and they're utilizing it. So, the program is working as it should. The scholarship program is working as we would like it to. And we see that families are taking advantage of the scholarship. So just want to leave that note there. And Dr. Cook has all the numbers and the percentages, but the message is clear here that this program is working and this is a positive problem for us to have.
I was going to say that is, when we worked hand in glove in 2022 to create the presumptive eligibility system, this is a really good, we anticipated that this might happen. It's a really good problem when you have a 30% increase, and I mean that's thousands more Maryland families that are getting access to childcare. It means they're able to go to work, they're able to get their educational supports. So it's a huge deal. And again, I know we're really excited. I think on both the Budget and Tax and Appropriations committees to dig in and make sure that we don't see that backslide. And I think we're all eagerly anticipating the December 1st report on the blueprint implementation. So thank you all for being here. And I don't, Delegate Smith, your hand is still up. Do you have any more questions?
No, let me put it down.
I just have one request out of Dr. Lean and the Office of Government Affairs. We saw an audit report earlier this year that cited over 170 repeat audits out of our local education agencies. If we could follow up with a request for further information about how those repeat audit findings are being addressed by our local school systems, that would be great.
Sure.
And we can follow up that later.
That sounds good. And just to be clear, when you say repeat audits, most of the times they're just responses for clarification on questions, not necessarily the repeat of a full audit, but happy to follow up with you on that as well.
Great, thanks. Seeing no further questions, I think Chair Solomon, we can proceed. All right, so we'll go next to the evaluation of the Office of Student Financial Assistance within the Maryland Higher Education Commission. And for the beginning of this, we'll turn over to Mr. Powell.
Thank you, Mr. Chairman. Thanks, Eric, for the slide. So we evaluated the Office of Student Financial Assistance. They're part of the Maryland Higher Education Commission, or MHEC. And among other things, they administer grant and scholarship programs, a variety of them, for higher education. We focused on just one of those programs. It's called the Educational Excellence Award Program. Sometimes that's known as the Howard P. Rawlings Awards. And next slide, I'll tell you a little bit about what they are. So these are grants that are intended to help low-income students attend a Maryland college, and that's both public and private schools in Maryland. There are two primary types of grants. One called Guaranteed Access, and we'll call those GA. They can be up to $20,000 a year for 4 years. And then there are grants called Educational Assistance that have been capped at $3,000 per year since they were created in the late 90s. Generally, the GA grants are for the lowest income students, and the EAs are for slightly less low income students. Expenditures on this back in fiscal 21 were about $80 million. It's grown to $112 million, I believe, in fiscal 24. That small slice of the pie is a little bit of money that goes directly to campuses for kids who may not have got their application done on time or things like that. All of these three types of grants share a budget. So extra money that goes to a guaranteed access grant would be money unavailable to these other forms, and vice versa. Next one, Eric. So as I said, the award amounts, they average about $12,000 or $13,000 a year for the GAs, which is intended, in addition to a Pell, to cover the full cost of attendance at a public school in the state of Maryland. The EAs average about $2,000 a year. The EAs go to about 20,000 students. That includes kids in their second, third, or fourth year. And I'm going to call them kids. I got a 19-year-old in college, and I know technically he's an adult, but I'm going to call him a kid. The GAs go to about 2,000 kids per year, including those that are renewing for their second, third, or fourth year. As I mentioned before, the EAs have been capped at $3,000 since 1996. Meanwhile, as we all know, the cost of attending college has more than doubled since that time. The percentage of the budget that goes to each of these two kinds of awards is about 50-50. Next one. So for either of these grants, the EA or the GA, you must be a Maryland resident, you must have some financial need, and you must be enrolled full-time. For the guaranteed access grants, the more generous ones, you have to be 22 years or younger when you get it the first time. You have to be within 1 year of graduating from high school. You need to have a household income below a poverty index, and you need to have at least a 2.5 GPA in high school. And I should have mentioned this at the top. So that is how these programs used to be. This past session, bills passed that became Chapter 634 that have changed some of those eligibility requirements, and I'll talk about those further in the report. Next one, Eric. So that household income for a GA needs to be below generally 130% of what's called the FPL, the federal poverty level. And just to give you a sense of what we're talking about, for a family of three, that would be somewhere around $32,000 or $3,000 a year of income. So below that, you are eligible for a GA. $1 above that, and you are not. Many of these recipients have to verify their income in future years as well as when they're applying for it. All the applicants have to apply for what we call the FAFSA, the free application for federal student aid. That's the federal financial aid application. But they also need to create a Maryland specific account, which is called MD CAPS. GA applicants also need to submit an official transcript, and that's not a report card. So it's something that they need to get from the school. And if we go to the next slide, I'm going to let Grant or Diana, I can't remember which one, take a couple of these.
I'll jump in. So as Mike just talked about, there are a lot of eligibility requirements for accessing the EEA awards. This figure is just showing us specifically for the GA grant program, which is the larger of the two. The eligibility and application requirements for GA limit the number of potentially high need students who ultimately get offered an award. So we know that 44% of Maryland's FAFSA applicants who intend to go to an in-state school are over the age of 22. These students wouldn't be eligible for a GA grant. We know that 51% of Maryland's public high school graduates and GED completers don't enroll in a university or college program right away. These students also wouldn't be eligible for a GA award. And as Mike mentioned, if a student is just above the income cutoff, the 130% of the federal poverty guideline, if their family makes just $1 over, then they're also not eligible for the larger award. Next slide, please. So among the pool of students who do meet the eligibility requirements for a GA grant, many still aren't offered an award. We're very grateful. The Maryland Longitudinal Data Center shared enormous data sets on enrollment and financial aid for undergraduate students enrolled in Maryland's colleges and universities. And using these data, we were able to look at EEA awards to students who were potentially eligible for a GA grant. And this is based on their family income, their age, and then their full-time enrollment status in a Maryland school. So less than 1/3 of these students ended up getting a GA grant. About 1/3 got an EA, which is less money, capped at $3,000, and more than 1/3 didn't get any EA award at all. And you can read a lot about why this is the case, but Grant is going to talk about two specific reasons that we found. And these are challenges navigating the application process and a general lack of awareness about the EEA program among eligible students and their families. Take it away, Grant.
Thanks, Diana. So we looked first at the incomplete applications in the 2021-2022 academic year and found that for students who look to be income eligible for a GA grant, half were missing or lacking some sort of transcript documentation. Also, half were missing or lacking income verification documents. Often providing a transcript involves getting a high school guidance counselor to upload it into the MTCAPS portal. Some systems or schools do have an automated upload system, but not all do. Providing income verification is required a minimum of 25% of the time by law and has been as high as 60%. Next slide. In 2020, over 16,000 students were offered an EA or GA grant and did not accept it. A large majority of these unaccepted grants were EAs. Possible reasons identified by stakeholders included confusion and/or email problems, a decision to attend an out-of-state school, a decision to not attend college at all, and COVID may have also played a role in this particular year. Next slide. In fiscal year 2022, MHEC identified almost 18,000 MD FAFSA completers as potentially eligible for a GA grant. Ultimately, 1,644 awards were given, so that's about 1 in 10 of those identified as potentially eligible. OSFA does not have any full-time staff dedicated to marketing and outreach. Rather, it relies on MHEC's communications staff. In Pennsylvania, the Pennsylvania Higher Education Assistance Agency, or FIA, has 16 staff dedicated to marketing and outreach. Next slide, please. So this slide shows various postings by users on Reddit, as well as a people also asked section from an incognito Google search for MHEC. We also asked the MHEC Student Advisory Council if they had heard of MHEC or OSPA before attending college and received a unanimous no. Next slide, please. Renewal of GA grants is higher than that of EA grants. By year 4 of college, over half of GA students renew their grants, while only 16% of EA students are still renewing. So 84% of students who got an EA grant in year 1 have stopped renewing by year 4. Next slide, please. The graduation rate for the neediest students, or those with an expected family contribution of $0, is 31%. The graduation rate for those getting a GA was 72% and has climbed from below 60% in 2008. For comparison, the national rate for all students is usually somewhere around 60%. Next slide, please. So this gets to the whole dollar above the GA cutoff, and a student whose household income is $1 above the limit for a GA grant is only eligible for an EA grant. EA grants are capped at around $3,000 per year and averages around $2,500 per year. Students who are just above that threshold are ineligible for a GA grant and have the highest unmet need. The difference between the GA and EA side of that cutoff equals about a $7,000 difference in additional unmet need for the child. And I think with that, I'm going to turn it back to Mike.
Sure. Look, this is a lot of information. There's a lot more that's in the report, but maybe the best way to understand Maryland's system for doing this is to contrast us with 2 of our neighbors, which we did in our report. So Pennsylvania and Virginia. One of the biggest differences is the generosity of Maryland's Guaranteed Access Award, which at times has been almost $20,000, maybe even a little over $20,000. By contrast, Pennsylvania's recently was up to close to $6,000 maximum. And then in Virginia, it can vary by institution, but it's not intended to cover room and board. It's just intended to cover tuition, fees, and books. Pennsylvania does not have a GPA requirement. They automate income verification. They have a later deadline. They will give money to part-time students. And they have an automatic link in the FAFSA, the federal application, that automatically takes you to the Pennsylvania application, which is only a few additional questions. To be clear, in Virginia, this particular program is only able to be used at public schools. They have separate grant programs for their in-state private schools. The institutions in Virginia grant the awards, and the state delegates a lot of the authority to the schools. Virginia does not guarantee the awards. So even if you meet their criteria for this, there's no guarantee that you would get one. Eric, can you skip to the last slide? So we had a bunch of, in our report, what we called options, which were different things you could do that might improve this. And as I mentioned, Chapter 634 has already made some changes to this program. So as of this summer, the GPA requirement has been eliminated. And one of the things we found is that most kids who are accepted and enroll in college in Maryland meet that GPA requirement anyway. They also expanded the eligibility up to age 26, and for people who graduated within the last 6 years of graduated high school. And then 2 years from now, a big shift is going to happen. Essentially, OSPA is going to provide financial aid information from the FAFSA to the schools in Maryland. And those schools are going to be able to look at their applicants and determine if somebody meets the eligibility requirements for a guaranteed access grant. The schools would be able to include that in their financial aid packages. And if somebody enrolls, they'll be able to get reimbursed by OSPA. The change it's going to make to the Educational Assistance Awards in 2025 is that any funding that's left over after that money is distributed would be distributed by OSPA as EA awards. And this is a lot of information. And with the co-chair's permission, I just want to, this sort of concludes our presentation, but I wanted to share a personal story that maybe would make this, put a human face on our report. So we published this in December, and in January, the legislature started moving bills forward that became Chapter 634. And not long after that, my wife reminded me that a kid that we're friendly with was going to be graduating from high school, and he had been accepted into a couple of colleges, and he was hoping to go. And this kid is different than a lot of kids because he and his family are refugees, and they've only been in this country for a couple of years. And they also are extremely low income. And I put my citizen hat on and took my DLS hat off, and thought this kid could use some help. And I got in touch with somebody who runs one of these organizations, a nonprofit that helps kids be able to get into college, pay for college, and be able to finish college. And the first thing I said was, do you work at this kid's school? Because not every school has a nonprofit that's working with them. And they said, we do. And I said, well, can you find this kid and try and give him some help? And they said, he's already on our list. We're happy to help him. And I said, look, I apologize in advance, but I'm going to bug you relentlessly to make sure that this kid is doing all the stuff that he needs to do to be able to get whatever money that he's eligible for. And I did. I still owe somebody dinner for that when I'm allowed to do it. And so I would check in, is his FAFSA done? Does he have his MD-CAPS thing? Does he need to verify his income? Has he uploaded his transcript? All these kind of things. And all that stuff was done. And finally, we get to May when kids are notified of any money that they got from the state of Maryland. And this kid gets notified that he didn't get any money. And I couldn't believe it. And I just didn't understand and we know all the barriers to this, but what it was about him. He was a valedictorian of his class. So I knew his grades were fine. I knew his family was under the income threshold. And it turns out that this kid, when he filled out his FAFSA, had not listed a Maryland school on it. And because of that, he was not eligible for this money because that was one of the things that you had to do. Now, thankfully, in this kid's case, with a lot of help, he was able to retroactively get that money. He's a student today at Coppin State University. He's a track star and a nursing student. And him finishing college is going to make a huge difference in his life and his family's life. But maybe I'll close with just thinking about how much effort had to go into helping that kid get an award that he was eligible for, and how many kids don't have that help. And then also how many kids haven't the slightest idea that Maryland has a program for them that would help them attend college. So let me stop there. Happy to take any questions. Thank you for your time.
Great. Thank you, Mr. Powell and your team. Any questions from the members of the committee? No, we have MHEC coming up to be able to present their perspective as well.
Senator Lamb, I just wanted to jump in. It's not a question, but I just wanted to recognize Mike and his team. A group of us worked incredibly hard on, it was ultimately House Bill 923 that became law. Delegate Smith is on here, Chair Barnes, Senator Feldman, Chair of Tripoli. And I don't know that there's a better example, frankly, of an OPEGA product that literally directly and immediately changed people's lives in the state of Maryland. I was actually last week just at the gala, 20th anniversary gala for College Tracks, which is our big college access organization in Montgomery County. And I see Cassie smiling. I know we're going to hear from her shortly, but they're a smaller version of the great work that her organization does up in Baltimore. They work in about 5 high schools. And a couple of the counselors came over to me and said the bill just immediately has made the life easier for hundreds of students that they work with. And Mike, you and your team, literally worked hand in glove with our committees to get this bill together, to get it over the finish line. And I know sometimes our audit and evaluation reports can be dry and you're looking at graphs and numbers on paper. This one in particular, I want to take a point of personal privilege and just say thank you, because if it hadn't been for your team's work, I don't think we would have been able to get that bill through this past session. And it's just an amazing partnership. And again, it's literally changing lives for our young people in the state.
Thank you very much.
Passing it on to MHEC. Thanks, Senator.
All right, thank you. We'll welcome Secretary Rye.
Let me invite my chair, Cassie Motts, who's here to make some remarks at the beginning.
Thank you, Dr. Rye. Thank you, Senator Lamb, Delegate Solomon, and
especially Mike Powell and your team. It was a fantastic report. And thank you to the legislators who were involved in the passage of the bill this past session. I agree with Delegate Solomon. It is already making a huge difference. I am here officially in my capacity as the recently appointed chair of the Maryland Higher Education Commission. But I have to tell you, this is a topic of great interest to me in my day job at College Bound, where, as Delegate Solomon said, we work day in and day out with Baltimore City public school students in their paths to and through college. And so we are directly impacted by MHEC and are working daily to make sure that Baltimore students, many of whom are eligible for the MHEC assistance, are able to get it. And frankly, when the governor asked me to chair the commission of the Maryland Higher Education Commission, the reason I said yes is because of this very topic in terms of reforming the Office of Student Financial Assistance. Luckily, I think we are on a great path for improvement under the leadership of Dr. Rye and his director of this department, Mr. Al Dorset, both of whom you'll be hearing from. But I just wanted to let you know that with respect to state government and having the ear of the governor's office and the commissioners of MHEC, this topic of making sure that MHEC is more customer friendly, that the processes that have been described that have been so confusing for so long is really, really a top priority for the state, for the governor's office, for me personally. And I can assure you that we are already taking steps to improve the processes. We will be announcing, I think, perhaps even later today, we are going to be having a virtual financial aid open house on Friday, November 10th from 10 a.m. to noon, where we're going to be having the secretary and Al Dorset answer live questions. We're also asking members of the public. This is really geared towards families, but also professionals like College Track, like First Generation College Bound in Prince George's County, and school counselors all over the state to send their questions in advance for the review of the secretary and Mr. Dorset. We're going to be rolling out our plans for really revamping this office and making it more customer friendly. So this is a really timely report. I want to thank everyone involved, and I will turn it over to Dr. Rye.
Thank you, Chair Martz, and thank you, Senator Lamb and Delegate Solomon from Montgomery County. I live in Montgomery County. I spent about 20 years at Montgomery College. I have devoted my entire career to access to higher education, creating more access, removing barriers, and of course, making higher education more accessible and more meaningful. And the experience that a student have going through higher education, making that more enjoyable. So this financial aid is certainly one of the top priority for Maryland Higher Education Commission. The report, Mike, thank you for the report. Thank you for the work that you do for the state. But let me especially thank you for helping a refugee student who finally got to Coppin State University and having a wonderful education. And I tell you, that will be a life-changing experience for him. So as you will hear from our director, Al Dorset, this report is very helpful for us. We are already making progress on a number of suggestions, and we have already made a number of improvements over the last few months. One of the things, a couple of things, our technology platform, MDCAP system, it's a well-known thing that it needs change. It needs improvement. Technology has changed. It's an obsolete system. So thanks to the legislature, we have funding, we are issuing an RFP, and we have building the process of changing that system. Some of the things that Mike's student faced, it's also caused by a very old technology system. Then we are trying to create a call center. The students who have questions, they can get immediate help. They don't need to go to people like Mike and Chair Martz to get help from MHEC. They can call MHEC and get assistance as soon as possible. The eligibility requirement is students who are eligible for these scholarships. Today, MHEC finds those students and sends an email to those students. Many of you have young kids, they don't read emails, do they? No. So sharing that information with the Cassie's organization LEAs. So they can run a list of their own students, and they will get a list from students. You have these 10 students who are eligible, and they will go and find those students and try to help them. So with that, I'm going to invite Al Dorset, our wonderful leader in Office of Financial Aid, and he will give you more specific information. Al?
Thank you, Dr. Rai. And thank you, joint chairs, as well as the rest of the joint committee members for allowing us to provide feedback on the review that the Office of Program Evaluation and Government Accountability did, which was a very detailed and wonderful job. I want to thank Mike Powell and his team. As Mike mentioned, in relation to Chapter 634 and House Bill 923, the dramatic changes take a lot of the observations or recommendations from the study, in which taking away the GPA requirement, taking away or expanding the 6-year eligibility, as well as students under the age of 26, is going to really expand eligibility for the GA program. And looking at the current 23-24 year, when we looked at those eligibility or changes in eligibility, just looking at about 1,460 students were hit because those changes weren't made for this current 23-24 year. In the aspect of looking at the average award for GA 20,200, we would look at that if things don't change and kind of are consistent with this year to next year, you look at really 6,770 students being eligible for the GA grant for a total expected of about a little bit over $107 million. So as we look at that expansion, we look at that there's going to be more need for funds in the EEA award. Right now, there's 112 million, with 2 million going over to the campus-based EAG program. If you look at the 107, you're looking at 3 million left over for the EA program, which we know about the EA program does between 40 and 30 million each year right now. So that expansion is really needed, and really that's not even the truest and accurate count, because we're really looking at not just high school students, but students that transferred out of state and now are coming back within 6 years of graduating from high school. How many of those students? Individuals that never even did a FAFSA and now are 23 or 24 years old and ready to go to college, that now will be eligible for the program. So that's the hard part, where we haven't gone out and requested or put in our over budget requests additional funds, because we don't want to request additional funds and still need more from there. We're looking at the aspect of really looking at when the FAFSA comes in December and we start processing FAFSAs, how many students are going to be eligible, and really looking at projections from there to go out and request additional funds, because we know funds are going to be needed. Additionally, within the report, one specific kind of recommendation that really stands out is the separation of funding for EA and GA. If we're going to keep both programs, really looking at the aspect of separating funds or allocating a certain amount, just like we do with CBAG, to the EA program, so we're not waiting to see how many students are actually going to accept GA funds, especially when we move over to the schools doing it. We're not waiting, but more so we can go out and award EA funds to eligible EA students. So that is a big key right there. So these changes are really going forward, and we've been moving forward on these changes. We're working with MSDE already to do a FAFSA training on the new FAFSA, which will now also only talk about the new changes or changes within the new FAFSA, but also changes within the GA program and eligibility requirements. These are going to go out throughout the whole state of Maryland, about 7 different locations. We've already worked with MSDE to put a reach out to the different county districts, high schools, other educational leaders, that they can attend the training, which will have about a half-day training at these different locations to really just educate individuals on what's going on with the FAFSA, so more people can help and assist students. Additionally, we're working with non-profit organizations, MSDE, with the Next Generation Scholarship Program, talking about our system, even though we are looking at having a new system in 2025. We know the need, and there's that time frame that we can't wait till 2025. So we are what we have with our current system, making updates, trying to push as much as we can with our current system, even with the Next Generation Scholarship, bringing those students to actually do their application and process through our current system. So our current system can have a tracking requirement. So when those students hit their senior year and they do their FAFSA or their MISFA, it'll actually connect with that table that they did their NGS program with, see that they're eligible, and automatically award them NGS. So we're hoping that that will push forward with getting more students to do the process and us seeing more students that are eligible for that guaranteed access. We looked at the separation between the EA program and the GA program and look at doing some tests or some studies on expanding the program. However, with the recent changes of the GPA and the expanded eligibility, we need to wait there, because when we really look at that increase, to do any more changes is going to even further that increase, and we don't know what the first changes are going to put as well as an increase. But that is something heavily on our mind and that we're looking at. And as Dr. Rai said, looking at the aspect of restructuring OSFA within MHEC, where we had current or previously OSFA was really broken down into kind of two units, need-based and career-based. Really that kind of made it quirky or kind of convoluted of how many programs OSFA has, what takes to run those programs, and what goes into communicating with those programs. So now we've broken up OSFA into several units: career-based scholarships, need-based scholarships, decentralized programs, our loan assistant repayment unit, our legislative scholarship unit, so that we have individuals that are overseeing those units with support under those units. So the biggest thing, as we've said, when we compare to FIA, Pennsylvania Higher Education Authority, when you look at the amount of individuals or employees they have with their department to do marketing, to run the program, to do the administration, to do the customer service, there's a larger gap. Even if you look at New Jersey, which wasn't mentioned within the study, and New Jersey has a program or a higher education program that just focuses on financial aid. Their group or amount of staff double what we have within the OSFA program. And they have those different areas to run those different programs, which they have some considerable programs like this. So that's the key. Even with outreach, we have these different ideas that, with the support that's come in, we can use external constituents to work with MHEC and OSFA to really get the word out more. So that's really kind of my comments there, and I'll take any questions that anybody may have.
Great. Anyone else from MHEC that is intending to speak, or is everyone else for questions?
Well, I think from MHEC side, we are done with our presentations and eager to respond to your questions.
Sounds good. Great. Thank you. Delegate Smith.
Thank you, Mr. Chair, and thank you to all the MHEC representatives today. It's great to see you all. Something I was just thinking about, particularly in the last remarks related to outreach, is that I recall a very long time ago, I used to run an AmeriCorps program at a public high school focused on future first generation college students. And as you can assume, navigating the FAFSA process, and a lot of that can be very intimidating if there's not been a history of your family members navigating that experience. And I know quite a few of us have passed legislation or assigned resources in the past to help organizations dedicated to assisting low-income tax filers. And it seems like there could be at the intersection of those relationships, those that are literally helping low-income tax filers with their sensitive information, some type of partnership where they're using the very tax information that would probably be informing the FAFSA to assist people in completing a FAFSA, either for themselves or for the young people that will need it. And I just didn't know if there'd ever been a history of exploring partnerships with those sort of organizations that are existing largely out of the confines of the educational system.
I think that's a fantastic idea, Delegate Smith. In Baltimore City, we've done that informally, but I would defer to the Secretary and Mr. Dorsett about whether that's been tried at MHEC, but I'm sure there's an opportunity to scale it statewide. I'm sure we could be doing better. I think that's a fantastic idea. Thank you.
Again, fantastic idea. We will certainly explore. I am aware of some of those partnerships with different institutions and organizations, but I'm not aware of any at MHEC. But as you know, I'm still new learning. But certainly we'll give a very close attention and see what can be done. Thank you.
Great. Thank you, Senator Hedelman.
Thank you, Mr. Chairman. I just want to follow up on my colleague from the House's comments and urge you to also take a look at those students who have to file the MISFA form, because we have a number of people I know in our county for whom that's an exceptional challenge, because the counselors that are helping them in their schools with large immigrant populations and students who may be undocumented but who still are eligible for aid, to navigate that process is nearly impossible. And they have discussed the challenges with finding someone within MHEC to help them in community. So if you had some dedicated, a person or at least somebody who really was familiar with this system and could help those college counselors and those students, that would be exceptionally beneficial. Thank you.
Yes, thank you for the suggestion. We will certainly do that. Let me also say that for our FY25 budget, we'll be seeking resources for Office of Financial Aid to do exactly those kinds of things. Thank you.
Yes, and I completely agree with Senator Hedelman, and I see Delegate Smith nodding. The MISFA is a bear, and for our students in Baltimore City. And I would say, and I sort of pushing this back to the legislators on the call, one thing that I've heard, and I don't know whether you've heard it, Delegate Smith and Senator Hedelman, is the selective service requirement is a challenge for the MISFA. When the legislation passed for the DREAM Act, it was required. The selective service has been eliminated, the requirement for the Pell Grant for students who are citizens. So that might be, I don't know politically how you can, if that's possible, but to the extent that you're looking for reforms to the MISFA, removing the selective service requirement would really help a lot of our students.
If I can add, that selective service requirement is only on 2 programs. Really the MISFA, which isn't, even a program, that's an application, and then the 2+2 scholarship. So that's the only time that the selective service is actually putting a hindrance on students. Students that complete the FAFSA do not have to do selective service. No other program requires selective service.
And Mr. Dorsett, you would agree it is a barrier, right? I mean, that's what we're seeing with our students on the high school side.
Yes, definitely that is a barrier when it comes to students on the high school side. And then that one, and then the other barrier would be the drug pledge requirement, which many schools have identified, and students have identified that they've forgotten to do. And that is still a requirement over the programs.
I believe the bill eliminated that, I think.
No, the drug pledge requirement is a separate area that covers all aid, so that it wasn't eliminated by the bill, and it's still a separate article of education.
I thought we eliminated that on the GA grant. I have to go back and look. I did just have one question, and again, appreciate you all being here, and Dr. Rai, we miss you at Montgomery College, but we're glad you're in the new role. How is the implementation going for the bill on working with our university system and our colleges and universities? Because obviously so much of this, both at and we didn't even talk about the Promise Scholarship changes, but is around decentralization of the program, moving it closer to where the actual students are and where they're getting the most support. How is that going? I know that's going to be a big administrative shift, not only for your team, but for our higher ed folks as well.
Yeah, so the Promise Scholarship decentralization, as you know, Delegate Solomon, I was on the other side advocating for it 6 months ago. So I think that's a welcome change. We are moving forward. I think there are some implementation ideas that Al Dorset and his team is working with Brad Phillips and my colleagues. They're sorting out those issues. And I think, they're very successful, and that decentralization, 1st July 2025, I believe, it will happen on time.
Great. The only other quick question I had is obviously with the change in the federal FAFSA, and I think a lot of the welcome changes there, I guess two parts of the question. One, is there any additional statutory change, and you don't have to answer this now, that we'll need to make sure that our state aid system fully integrates with the change in the data and the change in the questions at the federal level? And then this year, because the FAFSA deadline the opening of the FAFSA has been pushed back to December 1 from October 1, are there any concerns or anything that we have to do this year to make sure that our students don't fall into a little bit of a gray zone?
So let me tell you, Delegate, a lot of proactive work is being done on that side. I'm going to ask Al Dorset to provide more details.
Thank you, Dr. Ryan. Definitely there is concern about the March 1st deadline with the FAFSA not being available until December, and some are even saying January 1st. So there are concerns with that, where individuals asked if the March 1st deadline was going to.
Al, your audio is cutting in and out.
Am I still having problems?
Well, I think we can hear you now.
Okay. Apologize for that. In regards to the process within the legislation and changes within the FAFSA, no real big changes within legislation. The only concern within legislation is that legislation does identify that no later than October 1st, OSFA would have a list for the institutions. With the FAFSA usually being available October 1st, that is something that is a concern, because we wouldn't have any information available yet at that time. But what OSFA has been doing is we have a EEA study work group that we've been working with, and plan to give our list of, or a summary of review. The EEA study work group consists of not only OSFA members, but members from county community colleges, private and public universities, as well as individuals from nonprofit organizations. So we've been reviewing the bill, looking at different concerns within it and suggestions, and we'll be giving that to the commission, and hopefully the commission will share with delegates and senators.
Ellen, I think you cut out, you said there was concern over, I know the March 1st deadline is what we need, what our students need to be able to get eligible for state aid. Is there conversation going on at MPAC? That's, I think, where you cut out, around shifting that deadline, at least this year, if the federal form's not available until January 1?
Yes, so that conversation has been within our office, and I believe Mr. Derek Coley, which is our new director or executive director with legislation, will be sharing.
Derek, did you want to add anything, or are we, that's pending? We'll get that soon.
Yes.
That's pending. That should be
It's
coming.
pending. Yes,
Okay.
sir.
Delegate Solomon, I think you're very wise to flag the issue. I'm actually calling in today from Dallas at a national conference for organizations, higher ed organizations, nonprofits who do college access work. And there's a lot of concern nationally about this FAFSA deadline. And, you know, the feds are saying December 1st, now it may be later. So we appreciate the legislature working with us. If it does get pushed later, we might have to push our state deadline later to make sure that our students are getting adequate time.
Yeah, and I think that, we are hoping the FAFSA deadline becomes clearer and how do we react to it. If we have to move the deadline, we will move. We have to understand what is involved in moving the deadline, and those are the things Al and his group are researching, and we'll come to you for guidance and help.
Great. Well, thank you all.
I would just add, and just so this group knows, the whole reason the FAFSA was being pushed back is because there's this federal effort to simplify the FAFSA. And I think in many ways it will be simpler. There will be fewer questions. But for students who are accessing our guaranteed access grant, which as Mr. Powell described is for our neediest students, I think it might actually end up being a little more complicated because it's requiring a lot more from the parents' end. And so we just, on the state side, need to be very mindful that we at MHEC are doing everything we can to be supporting students filling out this new FAFSA and our state aid. So we're very aware of the issue. And as the secretary said, trying to get new pins soon on the OSPA side to be more customer friendly and trying to simplify some of our systems. I really like Senator Hellerman's idea about having a dedicated MISPA person. And I think we need to reorganize the resources that we have within MHEC. And I think that Al is really, Mr. Dorsett has been spearheading that. But I also think we're going to be hoping to get new resources too, because there's a lot of opportunity for improvement. And this is a state agency that's very crucial to the lives of many of our young people across the state.
Okay, any other questions? All right, I think we have reached the end of our agenda for today's hearing. Certainly want to thank all of the members for participating and all of the agencies and their staff for also attending this as well. There will be another meeting of the Joint Audit and Evaluation Committee taking place on November 14th, and we'll have more information forthcoming to the members about that. Chair Solomon, anything you would like to add before we close out?
I was just going to thank everybody again. I know this hearing went a little bit long, but I think there was a lot of really important conversations that were had, a lot of important policy. Thanks again to Mike and the whole OPEGA staff, and for the millions of people watching us online. If you want to read all of the OPEGA reports, the DLS website under publications, and you can search by year and see everything. I know that we probably should link them on the joint audit page, but that's where you can find all the publications. And just again, appreciate everybody being here.
Yeah, thank you to Mike and your team. I know you all do a lot of hard work as part of the preparation for these hearings and also for the report. So thank you and your team too as well.
Thank you.
Thank you.
All right, with that, we're adjourned. We'll see everyone in November. Thank you all.